Hello, everybody, and thank you for coming along tonight. And thank you to Rena and Ciara and team for having us here tonight. So as Rena said, my name is Mary Kilroy. I'm the social prescribing coordinator in Tubbercurry Family Resource Centre, covering Tubbercurry and South Sligo. And Loretta is my colleague based in Sligo Family Resource Centre, covering Sligo Town and parts of North Sligo. And I just want to, I suppose, talk to you a little bit just around the background of the project and where it came from. So this project started late November last year. It is a 6-month pilot project for Sligo, Leitrim, Cavan and Monaghan, which is known as CHO1 within the HSE. It's funded by the HSE, Sláintecare and Pobal. And I suppose there's a number of us workers now then placed around the county. So in Sligo, there's 2 workers. In Leitrim, there's 1 worker. There's 2 in Monaghan and there's 3 in Cavan. So I suppose we're covering quite a broad area under the project. The project is the pilot itself is due to come to an end around the end of May, but there are lots of plans at national level at the moment to secure funding to keep the project in the area, which is great news. And we're delighted that a project like this for health and well-being been recognised in our area and been able to be brought forward into the future past the pilot. So I'm going to pass you over to Loretta. She's going to talk to you a little bit about what is social prescribing, who is it for, how does it work, and what are the benefits to being involved in social prescribing. And if at any point during the presentation that you have any questions, feel free to pop those into the chat. I'll be keeping an eye on those, as will Rena. And we'll be able to answer any questions people have at the end. You can ask at the end or you pop it into the chat function, which is, if anyone that knows how to use it, you'll just see it at the bottom of your screen, usually in the middle, and it just has a little bubble there that says chat. So if anyone has any questions, feel free to pop that in there. So I'll pass you over now to Loretta.
That's great, Mary. Thanks a million. Hi, everyone. So what is social prescribing? So social prescribing, it's about taking a community development approach to mental health and well-being. It is about connecting people with the activities or supports within their local community with the aim of improving and protecting each individual's mental health and well-being. So the project in itself, it gives individuals the time to identify any issues that they feel that might be having an impact on their overall mental health and well-being. I always like to tell people to look at it this way. So if you go to your, if you're feeling unwell or you're injured, whether that's physically, mentally, emotionally, and you go to your GP and they prescribe you a medication or they recommend another medical intervention to see you right. But when you use the social prescribing service, you're being prescribed a non-medical treatment to support you in your health and well-being. So I suppose, keeping that in mind, we would like to look at health and well-being and the overview of what it's about. So we would like to look at it holistically for each individual, and when we say holistically, we focus on absolutely everything that contributes to their health. So that could be things like their social health. So, what is their connection? Do they connect with their peers and their family and the community? And what would that look like for people? We'd also look at their physical health. So are they keeping active? Are they eating well? What's their overall lifestyle like? How are they managing any health difficulties that they experience? Also, their emotional health. What are their feelings? What's their self-esteem like? What coping skills do they have, and the relationships around that? We'd also kind of look at their mental well-being. So what are their thoughts, their moods and feelings, and how they manage them on a day-to-day basis. When we look at it holistically, it can also mean their environmental health. So kind of where they're living, their financial health, what does that look like? Are they struggling financially? Their intellectual health, and also their spiritual health. So essentially we're looking at all areas that affect a person, and while doing that we focus on what's working well and also what areas that they're struggling with and how we can help support them in those areas. So who's it for? So social prescribing is for absolutely anyone aged 18 and up. The feels that they need the support to help mind their health and well-being. So take for instance somebody that's unemployed. They may need some sort of supports to help get them back into the workforce. Take somebody that's retired. They may want to have some sort of social interactions and join a group of some sort. Then take somebody that's new to the area. They might want to just integrate into their community and avail of different supports there. So it can be for somebody that's that may have some poor social supports and feel isolated, lonely, or disconnected. So sorry, back. So take this as an example. As you can imagine, when a new baby arrives into the family, there's initial joy and excitement. When the new arrival, it brings so much happiness to the family unit, but there's also change within that family. Some people, they're ready for change, others are not so ready. But regardless of how ready someone is, they can still find the whole experience overwhelming. And sometimes they can end up feeling lonely, isolated, and they start to self-doubt. This can bring heightened levels of anxiety and maybe some low states of depression, which in turn can lead to the family's health being affected. So linking in with the social prescribing service will help connect the person with the supports in their local community and hopefully reduce any fears and rebuild confidence. So essentially, it's for absolutely anybody who wants to be linked into the community and experience those benefits. So how does it work? So the project, it works on a referral process. So a person could be referred through their GP, their primary care team, community mental health service, and community organisation, and also a person can self-refer. So once that referral is made, the coordinator will make contact with the participant over the phone. They'll make contact with that participant over the phone to acknowledge that they've received the referral. And they'll also give kind of a brief outline as to what the social prescribing is about and what the person will expect from it. We'll also arrange an appointment with the person, so we will at a time that suits them. Then we will go and have that initial appointment, so we will with the person at the time that suited them. And within that appointment, the coordinator will have a chat with the person and kind of see where they're at. Again, we look at all the holistic elements of their well-being, and we'll kind of together we look at maybe doing a well-being plan, and by doing the well-being plan, this kind of helps us and you as the participant to identify things that matter to you and how we can then best support you in achieving those goals and improving your health and well-being. So when we have that conversation with you, we'll also look at your interests and what it is that you'd like to do or where you'd like to go. So again, that's achieve your goals essentially. But when we have that conversation, the coordinator then will go away and do a little bit of research about what's available in the community for that person. And they will link back in with the person and say, X, Y, and Z is available at such a time, such a date. Is it something that you're interested in doing? If it is the thing that the person is interested in doing it, the coordinator then will link that person in with the activity. And once the person starts the activity, the coordinator then will link back in with that person after about 3 weeks, 3-4 weeks of starting it, to see how they're getting on, and whether they're actually enjoying it, if they're finding that it's of benefit for them, it's reach, you know, their goals are being met somewhat. And then again, we will link in with them towards the end of that activity, again, to get that feedback, to see whether the activity or the support has helped them. And if it is the thing that it has helped them, brilliant. We can look at if there's any future supports needed. If it is a thing that the person didn't get anything from it, then we can kind of revisit their wellbeing plan and look at some sort of some other activities that will help them reach their goals.
Do you want me to come in there, Loretta, just briefly on the referral process?
Oh yes, yeah.
Just to say, I suppose with the social prescribing, a lot of people ask, well, how long am I involved in a project like this, or how many appointments, or what does that look like? How long will we be working with an individual? And I suppose it depends on each person. Some people will come to us and they have a specific idea. So they may come to say, look, I'm really interested in Tai Chi, or I'm really interested in yoga, or I want to join a fishing club, or I want to join just something very specific. And in that sense, that would be called more of a brief intervention, where we would signpost a person and link them into those specific services. While other people might be a little bit stuck in a rut and they're just not sure exactly what it is they want. They have an idea, and that's where the wellbeing plan will come in. So we'd be looking at, what's already going well, where are the strengths, what are all the things that are going well, and then we look at the areas of, what is it that, where are the areas you maybe feel you need that bit of support with, or what are your things you enjoy doing? Some people want to just learn a new skill, others want peer support. So we build all of that into the wellbeing plan. So we'd be looking on average of probably having 4 to 6 appointments with a person over probably 10-week period. So there is, I suppose, a beginning, a middle, and an end with a social prescription. And I suppose that's nice to know too, because sometimes people are wondering, is it going to be very short, or is it going to be a long-term commitment that they have to make? And it isn't. It's, you're looking at, working with your social prescriber over about 8 to 10 week period, and it'll be closed off at that stage. But you would also, I suppose, before it's closed, left with the resources and the support you need to carry on without your social prescriber. So that's all I wanted to say on that one, Loretta.
That's great, Mary. Thanks a million. Okay, so what does a social prescription look like? So social prescriptions can be absolutely anything from any of these. So take, for example, you have a person living with chronic pain or fatigue, and it's impacting their overall mental health and well-being and their day-to-day living. So by linking them in with a social prescription, such as take, for instance, the HSE's Living Well programme, that programme in itself, it looks at absolutely everything from pain management, healthy eating, lifestyle choices, mindfulness, and so on. But essentially what it does, it helps the person engage and take control of their own health and well-being in the long term. So we have examples there of cookery classes, support groups, volunteering opportunities, community gardening, things like that. Like cookery classes, it's great. Another example would be somebody that doesn't know how to cook, and they're living off takeaways or ready-made meals, and it's impacting their health. And I suppose their weight, so maybe they might want to link in with maybe a weight loss group, or even a cookery class to help them learn how to do, prepare healthy meals. So the benefits then of using the social prescription service, can I suppose it can lead to a wide range of positive health and wellbeing outcomes, such as improvements in quality of life and their general wellbeing. So reduced symptoms of depression and anxiety. It helps remove barriers to inclusion. It gives participants a sense of belonging and being part of that community. It's a non-clinical, community-based approach, and it's very much person-centred. Again, taking the holistic approach to looking at a person's social, emotional and mental well-being. So those who have already participated in the programme have said that the positive impact that social prescribing has had on their life is immeasurable. Life is now full of possibilities. Another person has said that I feel more motivated to attend the course and the group, as I'm getting many benefits from both. My mood has been lifted, my confidence and self-esteem have improved, and now feel more involved in my community. So this sums it up, sums the whole thing up. So it does a simple idea, but can make a huge difference to someone's life. So on behalf of myself and Mary, I would like to thank you all for engaging and coming along tonight to see what it's all about. I'd like to thank Rena and all the crew at Sligo Volunteer Centre for the opportunity to share this. And if anybody has any questions, myself and Mary are delighted to answer them for you. Thanks a million, guys.
Thanks, Mary and Loretta. I'm just going to throw a question in first, if that's okay.
Yeah.
I was just wondering, some of the activities you described there obviously are very accessible to people, but I suppose what if cost is a factor for people, or people who maybe aren't able to access some of the activities because of their financial situation? Is there any provision for that?
I'll add that here. There isn't provision in terms of funding individuals to take part in activities, but a lot of the activities that we'd be aware of will be free of charge. We would also have a lot of resources that we can send to people that are at no cost. And often when we're working with people, a lot of their plans are around actions they will actually take themselves.
Okay.
So a lot of the time when we're talking to people, there's particular things they want to do, but they just want that support, that motivation, that planning piece to help them put those goals on paper. So we'd have people that are interested in, just getting more exercise, people that have said, I really want to write something, but I just don't know how to start. And we might talk about journaling, or we might talk about poetry, or we might talk about all the ways that, you can write, or so a lot of the time it's internal resources that people are using, but a lot of the activities that we will be aware of, a lot of them are free of charge. And then those people that are coming to us, we'd say through mental health teams, or people that are suffering with mental health difficulties, often can be referred to groups where they can get life enhancing vouchers, which help support those costs. So I mean, there's so many resources and supports out there at the moment. It's a huge amount, and there's new things coming on stream every day. So our job is to know what's available, or to find out, and to help link those people to those resources.
Okay, great. Thanks.
Yeah, thanks a million. I had a question there as well. I was just wondering about, I know you said you can self-refer, so you can just ring yourselves, but you can go to your GP either and say, I've heard about this thing and I feel it'd be of benefit. If somebody comes to you though and they say, look, I've been feeling down, I haven't told my GP and I don't want to, like, how are you connected to the GPs, or do you have, there seems to be a connection, but I just don't fully understand it.
Yeah, so it depends on the person. So if a person comes to us as a self-referral, there's no referral pathway there. So unless they want us to feed back to a particular person that's supporting them in their health and well-being, then we will do that. But if a person doesn't want that, then that's, that won't happen. So, but if a referral does come in from a GP or another, community care team, or whoever the case may be, we do refer back to them. So we do in terms of letting them know that the participant has engaged in the social prescription, and again that it's working well for them, and at the end point then to let them know that they've closed off from the social prescription.
Brilliant. Yeah. Okay. So it's as confidential as people want it to be. You know, you can
Yeah,
call with their
yeah, absolutely, yeah.
Yeah.
Brilliant. Okay. Listen, I'm going to stop the recording at this point so people can feel really free to ask questions. But it sounds, just for the benefit of anyone who's watching this back afterwards, it sounds like the ideal thing for some people who just need a bit of motivation. They need a bit of help to take those first steps, you know, to getting involved in things and getting involved in the community and pushing themselves outside of their comfort zone a little bit, maybe. So, okay, I'm going to stop the recording here. And thank you very much. And goodbye to anybody who's who's been joining us in the future. I see somebody else has come in with